Marianne Faithfull, Bob Dylan. It's all over now, baby blue. Coming up on the halfway point of the 11 o'clock hour. On the other side of this, an important conversation that parents need to hear.
The Mornings with Ed show. We'll be back after this.
Does your child suffer from any of the following? Nightmares, teeth grinding, bedwetting, snoring, falling behind at school, ADHD, autism, or underdeveloped jaws and body? OC Perfect Smile may be able to help with a simple, non-invasive procedure to improve your child's breathing and sleep. A lack of good sleep is often the underlying cause of these conditions. Dr. H and his staff at OC Perfect Smile can also assist adults who suffer from snoring and sleep apnea and are seeking an alternative to their CPAP. Call OC Perfect Smile today at 949-837-7112 for a free consultation that could potentially improve you, your child's, or your loved one's quality of life. Sufficient quality sleep is a major factor in living a longer, healthier, and happier life. Call OC Perfect Smile today.
Hey everyone, it's Lauren from My Laguna office. We're located in the heart of Laguna Beach. Come on by for all your shipping, office supply, and notary needs. We even do faxing. 303 Broadway Street, where Beach meets Broadway. 949-715-7500.
Explore high-speed internet services from Cox Communications. Connect with multi-gig download speeds powered by fiber. As the nation's fastest internet provider, Cox offers a variety of tailored internet plans to meet your needs. Explore their affordable and reliable internet services designed to keep you connected to the activities you love. Get high-speed internet at an affordable price. Fast and consistent connectivity without breaking the bank. Competitive pricing coupled with unparalleled customer service makes Cox the go-to internet provider for budget-friendly, high-speed internet solutions. Cox Communications.
B-Side Balcony is a hidden gem in Old Del Mar with a relaxed seaside chic decor where guests enjoy ocean views from the covered outside balcony. During cooler weather, B-Side's got you covered with amazing patio heaters and an intimate inside dining room. Every dish that comes out of the kitchen is a culinary delight. Chef Christophe sources produce from local farms and features organic free-range lamb, sushi-grade salmon, prime steak, imported cheese, and olives. San Diego's hidden gem, B-Side Balcony.
Bottom of the 11 o'clock hour. Welcome to a Wednesday edition of the Mornings with Ed show on the all-new Voice of Laguna. The first spot that you heard during that stop set was about sleep apnea, and that's important. And yes, we've discussed it with adults. We did a segment this morning, if you were tuned in during the 7 o'clock hour, about the absolute dangers of not getting enough sleep. And where sleep apnea would be a problem. That affects adults, and we were talking about adults this morning. In to talk about the effects of sleep apnea and the treatments for that on kids is Dr. Payam Haghighi. I'm sorry. He is Dr. H around these parts, and in for an important conversation. We welcome Dr. H. Good morning. How are you?
Good morning. How are you, Ed? Thanks for having me.
Doing very well. Thank you for coming in, Dr. Haghighi. It's important. It's an important conversation. Sleep is important for everyone, but it's especially important for parents to be aware of problems their kids might be suffering from. So what are some of the underlying, first of all, if you wouldn't mind for the audience, define sleep apnea for us.
Absolutely. Well, sleep apnea in general means is kind of a sleep disorder, and a person stop breathing repeatedly during the night while sleeping. So what happened to the sleep? Actually, you get a very poor sleep quality, and that causes a lot of problem for the kids and for adults. So when we sleep, we have a few cycles of sleep that has to go from the like shallow sleep to deep sleep, REM sleep, and come back. So if this get interrupted all the time, we never get the actual restorative good sleep. And that is very important for both children and adults, but mostly in children.
Okay. And what would, so let's say there's a parent out there with a school-age child. They're their kids aren't really doing well or as well as they think they should, what might some of the underlying symptoms be?
Yes, very good question. For children, there are many things that you need to look for. So first, if they are having difficulty at night, either sleeping with nightmares, like waking up in nightmares, and or sweating, or grinding, or snoring, these are things that we want to look into. But in general, untreated sleep apnea in children could cause ADHD, bedwetting, difficulty in school, snoring, restless sleep, delayed growth, nightmares, lower IQ, chronic allergies, crowded teeth, dark circle under the eyes, and swollen tonsils and daytime drowsiness.
And parents might mistake those symptoms for something else.
Absolutely.
Okay, and that in itself is a danger.
Absolutely.
And I want the audience to know, yes, your specialty is, and we know you here as a cosmetic surgeon, but you've been concerned with this and studying it for years. And I'm wondering, do we see the same signs in children as we do in adults? Are the symptoms the same?
Sure. Some of the symptoms are the same, but the thing is this: adults kind of adopt to it as they grow. Right. So it's very subtle. They don't understand what is happening to their body, and it unfortunately has a cumulative effect on their body. Right. It is getting worse and worse, and they don't even understand. So it brings up a lot of diseases like diabetic, high blood pressure, and eventually stroke, cancer, and even early death. Right. Anxiety especially is one of the main problem with not sleeping well. But it's very it's very subtle. It's very hard to diagnose it. So most medical doctors kind of have difficulty to figure it out. But for children it's a little different. They get hyperactive. They show all the symptoms of ADHD. And unfortunately, most of these children get diagnosed with ADHD and goes on the pills. Right. But that's not the root cause. And they also, for children, large tonsils, ear infection, and a lot of other symptoms like not being able to focus at their school and their tasks. So these are a little different with adults. Right.
Yeah. The lack of focus in a child, and you're right, they immediately go right to the prescription medication for ADHD a lot of times. And parents are just taking the words of the administrators and the teachers at the school. Hey, your kid's not focusing, you might want to get him checked. And then doctors, of course, in many cases will just, hey, yeah, ADHD, and they prescribe that. If a parent comes to you and says, yes, my child, here's my 10-year-old, they're showing these symptoms, they're not doing well in school, there's some behavioral issues as well, what are the things you check for? What do you do first?
The first thing I check is the growth of their jaws. So the root cause, the main reason behind the sleep apnea is some kind of airway problem. It's probably they don't have big enough airway. They have trouble breathing because their jaw is back and small. That's why they have crooked teeth most of the time. Okay. So what happens is that if they have small jaws, they are prone to get obstructed while they are sleeping on their back, especially compared to kids who have fully grown jaw and airways. So the first thing I look and I check is their jaw developments, and then I look at the tonsils, then I look at the teeth, how are they erupting properly? Does the jaw have enough room for all these? So there are a lot of stuff that we can check as a dentist if we are trained for that. Right.
I've heard that sometimes the uvula can be too large, and is it possible to shrink the uvula in a non-surgical way?
Absolutely. So there are actually, the reason behind the sleep apnea is in general are soft tissue.
Okay.
Tonsils, uvula, tongue, and throat muscles.
Okay.
So when any of them is enlarged or all of them are enlarged, that cause obstruction of sleep, obstruction of airway, and cause obstructive sleep apnea or OSA. So yes, we can laser some of this soft tissue and shrink them.
Okay.
But here is the actually root cause of that. Most of the time, the reason they are swollen is the mouth breathing.
Okay.
So when we mouth breathe, what happens? The unfiltered, dirty air goes right into the soft tissue and make them inflame. Versus when we breathe through the nose, they get humidified, they get filtered, and also the nitrous oxide get added to it, which is helping for exchanging the oxygen at the bottom of our, breathing tubes.
Why do some people and why do some children mouth breathe as opposed to nose breathing?
Absolutely important question, because mouth breathing in children is due to them not developing enough, and nobody knows, is the mouth breathing cause underdeveloped jaw or the underdeveloped jaw cause mouth breathing? It's very hard to say.
It's the chicken or the egg thing.
Exactly.
Then, right?
It's very hard, but it's very important for children to stop mouth breathing, because by mouth breathing, the tongue gonna position on lower jaw because the jaw is open.
Right.
It changed the face. It makes it longer. And because the tongue is sitting down, it doesn't do its natural job, which is expanding the upper jaw. When we sleep, we're supposed to close the mouth and place the tongue on the roof of the mouth and have it to expand the jaw. And when we are not doing that, we are actually letting the jaw to stay small and the face to elongate. And by doing that, unfortunately, we can damage a lot, and it stays forever with even in adulthoods.
Wow. And are there devices that you can offer to kids?
Absolutely.
Okay.
It's very easy for addressing this problem while a child is not developed yet and hasn't turned into the adult yet, because their bones are very soft.
Right.
We can and they're very malleable. So whatever that caused it a small jaw problem, we can actually reverse it by creating an environment to actually push this jaw back to its normal growth.
Like braces for the jaw.
Exactly. It's
Okay.
a braces for a jaw, but it's way less aggressive.
Okay.
It's very simple devices that we can give the child as young as 3 years old.
Okay.
And they just put it in their mouth and sleep with it. And that by itself cause jaw development and growth, and their airway develop properly, and they can breathe, and they are set for life.
Okay. And I know that there's always been a connection between sleep apnea and snoring. And if, for instance, a parent out there notices that on more than one occasion or, regularly their kid snores, that's a danger sign right there?
Absolutely. Snoring in kids, grinding in kids, grasping air time to time, these are things that we have to watch for. And snoring in kids means, first, most probably they are mouth breathing, because when we mouth breathe, the snoring gets worse. And secondly, means that they probably have a small airway that get clogged easily and cause this snoring, because the snoring and the sleep apnea, they both have the same root cause, and those are soft tissue enlargement somewhere, somehow, and or small airways. So because they have the same root cause, so most probably, especially in children, snoring is related to sleep apnea.
Okay. And I've seen, only with adults, I've seen sleep apnea machines that people have to put on at night. They seem really intrusive. They seem really uncomfortable. Has technology improved at all in the treatment of sleep apnea? Do they still have to wear these big devices?
Unfortunately, that still is the the kind of standard solution for sleep apnea in adults and even for children. This is very uncomfortable. I understand most people cannot tolerate CPAP, and the problem with the CPAP is as we age, this soft tissue gets more loose, and then the pressure we have to add to the pressure of the sleep apnea machine, and it gets way more uncomfortable as we use it. So yes, there is a solution for that. We can place these people on adrenal devices called MAD, or mandibular advancement device, which it positions the lower jaw forward and it opens the airway. That's one way to do that.
Okay.
And there are other ways too. For adults, we can also expand the jaw, even though the common belief is that we cannot expand adults, but we can actually. So there are appliances that we can use to expand the jaw for adults, and these are all newer appliances, and they are all FDA approved, by the way.
Okay. And even though our bones are a lot less pliable as adults, you can still...
Yes.
Okay.
Yes, we can still permanently add to the bone jaws and to the bone, and we can expand adults, and even 1 millimeter. If you open 1 millimeter airway, that's sometimes enough to help with this sleep apnea.
Right. Does it? It's got to bother you that that so many children who might have sleep apnea and these kinds of conditions are getting treated for ADHD. That's got to drive you nuts.
It does drive me nuts. It does really get me nervous, and these drugs have a lot of side effect. Adderall is really mess up with the brain,
Right.
and if they don't have ADHD, it is absolutely a wrong thing to do to put them on this medication. So my personal story, actually, first, the reason I got into the sleep apnea was because I was getting trained in the TMJ problem, smile design, bite, and all this stuff in Dawson Academy. Is a very prestigious academy, and then they kept saying that, hey, you need to be aware of the sleep apnea issue, because if you restore the teeth and make it perfect, and if the person has a sleep apnea, it's going to get destroyed, it's going to get broken or stuff like that. So they kept saying that you need to be aware of it. So that's when I was starting looking for, like, okay, what is a sleep apnea?
Right.
What can we do for it? And that's how I learned it. And I went to Vivo's therapeutic institution, so for the sleep, and I learned a lot during the years, and so much eye-opening information that I cannot unseen, really. And when I see patient, first thing I look if they have any kind of issue with the sleep apnea. So now the thing is this, then when I did go to this institute, I learned that me myself was suffering from sleep
Really?
apnea, and I had no idea. I didn't even know what sleep apnea is at the time, to be honest.
Were you a snorer? Did you snore?
I
or-
was snoring, and I didn't know if it's that bad or what does it cause. I thought it's just a snoring, so I kind of sleep from my side, and it helps.
Right.
But I didn't know what consequences it had, so I didn't know why I am drowsy during the day. I'm not I feel like kind of cloudy. I wasn't concentrating.
Right.
And I had to had a lot of coffees and stuff to kind of wake up. And so I was my own first guinea pig. And then my wife. And then my children. My child, my 9 years old, right? She's 9 years old right now, but I started when she was 6 years old.
Okay.
And my mother-in-law. For my mother-in-law, she was snoring so loudly that you could hear it from second, story. Yeah,
Wow.
it's upstairs. You can hear her.
Right.
So now she's quiet,
Okay.
and she feels much better, and she doesn't get up as often.
Did
as
she have to
used
do a CPAP or?
She was prescribed for CPAP.
Okay.
But after I gave her this MAD device,
Right.
she's happy. So she doesn't need to do that. And for my child, that's the most important one. She was struggling focusing. She was struggling at school. She wasn't doing well. And I knew she's smart. I just didn't know like what's the cause, why she cannot concentrate. My wife actually wanted to take her to the doctor for ADHD,
Right.
and I absolutely did not want that.
Right.
So when I learned all this stuff, then I said like, okay, yes, that's what I needed. So I placed her on this very simple device, and after a couple of years, now she is perfect at school. She concentrating. She behaves better. She doesn't have all those
'Cause
problems you used to have.
She's sleeping through the night.
She's sleeping through the night.
Right.
Not much nightmare. Very, very rarely she has nightmare, and that's probably because of those games she plays. And school actually noticed that.
Right.
School let us know, it's like, before and after. It was amazing. So, and she behaves better, and even the IQ goes up.
Right.
For children.
Right.
I've seen so many before after. I've seen so many situations. I did it for a younger person. He was 15. He was feeling drowsy, not concentrating, not focusing. After only 9 months, he is now in a water polo team. He's doing really good. And you can see the difference between how he looked before and how like now.
Right.
He was like tired looking and all this stuff. Now he's like very energetic,
Right.
and is a huge difference.
Sleep makes all the difference in the world. It makes all the difference in the world. And I had mentioned earlier today that I hadn't realized that I'd been living in pain for 5 years before the hip operation. Wasn't sleeping. Now I'm feeling 20 years younger.
Exactly.
I swear. Just a note for parents out there, that if you do think that your child is suffering a little bit in school or has attention deficit disorder in some way or behavioral issues, before you put them on the prescription medication for ADHD, check this out. Make sure that it's not sleep apnea. How young should parents start looking for these symptoms in their kids?
Actually, from when they born.
Wow.
So, having said that, it's very hard to do that at when they are like so little.
Right.
But we can check for tongue tie. If they have tongue tie, please have them untied.
Okay.
It's very easy to cut them, and it should be paid attention to. This is even mandatory in some countries like Brazil.
Right. Explain what that is, please.
So tongue tie is just a little bit of a muscle lift under the tongue,
Okay.
and it keep the tongue down.
Okay.
So the kid cannot push the tongue up,
Right.
cannot lift the tongue. If you lift the tongue, you can see the whole bottom of the mouth comes up with it. So that's tight. So there's a
Okay.
little tissue
Okay.
that we need to laser it or cut it, and it heals real quick.
Right.
So if we do that, then that child first can latch
Okay.
for the breastfeeding, which is extremely important, by the way, in the growth and development of the child to naturally expand the jaws. And if the tongue is weak, they cannot latch.
Okay.
That's very important. And also, while they're sleeping, this tongue cannot go on the top of the roof of the mouth and cause natural expansion.
Right.
So we have to pay attention to that from childhood, from the very beginning. And then, as young as 3 years old, there are dental appliances that we can use to help them out. But we have to keep watching for that. So what is very important is, if possible, breastfeeding for a couple of years, and then after that, not to use only soft food. If we can have them to chew somehow, some way. There are some stuff out there that they put like this vegetable on a little net and then have them to chew on it.
Right.
Just anything help them to chew. It causes them to develop properly. You see, Dr. Corocini, he studied in a very isolated area that people weren't affected by Western culture, and he studied all those children and noticed that there is absolutely no crowded teeth or no problem with growth and development of their jaw, and he tried to figure out what's going on. And the only difference was that they did not get affected by the Western culture. And what is the Western culture? Is the soft food. They were breastfeeding, and then right after the breastfeeding, they were giving hard food to their children.
Okay.
Have them start chewing
Right.
early ages. That's the only difference he could figure out. And they all have like fully developed jaw, all the teeth coming out, rarely need any kind of ortho. And then he noticed that after the Western culture got introduced to those areas, after even 2 generations, they start having all this problem with the children.
Right.
So first generation, 50% of the children had malocclusion. Only first generation. Genetic takes 20,000 years to cause that. So you see how environment and genetic together can cause a lot of issues. It's not just genetic.
This is absolutely fascinating. And I want to take a question off of the Text Connect right now from a listener who sleeps on their back and has woken up on occasion unable to take in air.
Yes.
Like their exhale was the last time. That's a sleep apnea condition,
That's
correct?
absolute sleep apnea. So here's the thing. When we position ourselves on the back, so if you notice the jaw, because of the gravity, falls back. And especially if we open, we breathe through the mouth.
Right.
So when the jaw goes back, the tongue goes along with it. And that is the reason that the airway get blocked.
Okay.
So while we are in a deep sleep, we don't notice that we are not breathing. We stop breathing, sometimes even a minute or so. And then all of a sudden, our body goes to the fight and flight. It's like, hey,
Right.
start breathing.
Start gasping for air.
Yeah, and then you gasp for air.
Right.
And unfortunately, that happened again and again and again because we need to go back to the deep sleep cycle.
Right.
So these people, unfortunately, cannot, they usually don't have a good sleep, and they usually are very tired during the day. And that causes sometimes, or most of the time, causes gain weight. You really gain weight without any reason. And when these people get addressed their sleep apnea, their weight drops without any change in their lifestyle. And that is very fascinating.
Same thing for children as well.
Same thing for children as well. Yeah.
And can an episode like that kill someone?
Absolutely.
Okay.
There are many famous people have been died, even athletes,
Right.
because they found their CPAP under their bed
Right.
in the morning because they didn't use
They
it.
didn't use it.
Yeah.
Okay. And before I let you go, what are the ways that that we can educate parents? This is certainly one of them, and thank you very much for doing this. But this is certainly one way to educate parents. But also school administrators and teachers and those that would first tell the parents, I think, your child has attention deficit disorder, or, they're a little, the first thing would be to prescribe that kind of medication. How do we educate everyone else?
I would strongly suggest that for children especially, they have them to be checked by an airway dentist.
Okay.
So there are many parents come to me and they say, like, look, I've looked for an answer everywhere. I go to the ENT, they say, like, well, if you want, I can remove the tonsil or adenoid to see what happened. By the way, the reason behind the large tonsil and adenoid mostly is because of the mouth breathing.
Right.
That caused that. So they go to the pediatric physician and they say, like, hey, there's nothing much I can do. I send you to ENT, or I send you to orthodontist.
Okay.
So they go to the orthodontist, and the orthodontist is like, well, it's too early. You have to wait till the baby teeth come out, and then we see what we can do, some expansion and stuff like that. So this is the problem that most parents deal with. But if they can find an airway dentist, a dentist that actually address the airway, they would probably going to help them a lot. And that's what my suggestion is, and also educate themselves, learn about it. There are a lot of books that they can read about, and I really like them to. I mean, the whole purpose of me here is to just educate people,
Right.
educate parents, and give them something to look for, to study about, and don't just say like, okay, what kind of pill I need for my child to
Right.
get better, because
Right.
that's not the solution.
Right. I'm delighted that you came here, and OC Perfect Smile is where you are. How do we find you?
We are in Laguna Hills,
Okay.
and we are very close to Highway 5. OC Perfect Smile, as you mentioned, ocperfectsmiledental.com, 949-837-7112. It's my number. And I would be happy to have a free consultation for any parents who would like to at least get the child checked and see if they might have a sleep apnea or not. I'll be happy to help.
It's a perfect first step, and we appreciate
Absolutely.
that. Dr. Payam Haghighi, OC Perfect Smile, so much more than cosmetic dentistry. I can't tell you how much we appreciate you.
That. So, quick thing,
Yeah.
when you listener asked the question about sleeping on the back, I just wanted to add. So definitely that person needs to check for possibly having a sleep apnea, and the best way for the meanwhile is to try to sleep on the side
Okay.
as much as possible. I know it's hard because when we go to deeper sleep and our side get tired, we automatically go on back.
Right.
There's no way to sleep on one side all night long.
I-
But that helps.
I'm a side sleeper. I sleep only on either side. I rarely sleep on my back. I don't know if it's a comfort thing or what. And I'm curious, do you still snore?
I don't snore because I use some appliances.
Okay.
Yeah, and I
Yeah.
expanded my jaw, and I feel much better. And I wake up myself in the morning rather than the clock wake me up.
You quite literally put your money where your mouth is.
Exactly.
Very good.
Absolutely.
Dr. Payam Haghighi, thank you so very much for coming in.
You're very welcome.
We've got to have this conversation and many more like this. Please come back.
Absolutely. Thank you so much for having me, Ed.
Thank you for being
Have
here.
a wonderful day.
Couple of minutes after the noon hour, it's the Mornings with Ed show on the all-new Voice of Laguna.
We're not bragging. We've just got a better product. Voice of Laguna, real radio.